Hi, Dr. Cheryl Carthouse here, naturopathic doctor. I'm going to take you through diaphragmatic breathing and how to do this. Our diaphragm sits here about right under our ribs, and it acts almost like a balloon. As the diaphragm muscle pushes out, we'll actually notice that the rib cage around the entire body, even very subtly, but also in the back, actually can move out a little bit. And we want to practice the diaphragmatic breathing so that becomes a habit, and we do this naturally when we breathe. The easiest way to notice it is to place your hands on the sides of your ribs. And when you breathe in, you might need to do this deliberately, is to push down in your abdomen, and you'll notice that your ribs pull out. And my thumbs are all the way around, as far back kind of as or at least partially to my back, so that I can notice if those ones are moving as well. So as I breathe in and out, trying to exaggerate it more so you can see it on the video as well. So my abdomen comes out a little bit, and I'm also noticing that my ribs expand. Again, like you're blowing up that balloon. The whole thing is expanding and then letting go as you exhale. Another way to try and do it is to lie on your back and place some books on your abdomen. And you should be able to push those books up and see them move as you inhale. So as you inhale, your abdomen goes out, and exhale, inhale, exhale. And that's also indicating that your diaphragm is expanding. Another way to do it is to, at the same time, you can place your hand on your back. And with this one, again, inhaling and exhaling. Inhaling and exhaling. And again, it's the whole circumference of the diaphragm that sits just below your ribs that should be moving out and in as you're breathing. Give that a try. Do it based on the recommendations that you provided by your respirologist or by your naturopathic doctor.